Understanding the warning signs your body gives you before a problem arises is incredibly valuable. One of my favorite books, The Technology of War by Sono, discusses the importance of having advanced knowledge, particularly in the predicting an enemy's actions before a battle. I like to apply this concept to health. Being aware of what's happening in your body by reading various indicators is crucial. The problem with healthcare today is that when you visit a doctor with the symptoms, they often treat the symptoms directly without using them to understand the underlying issues. However, what if we use these signs to truly understand what our body needs? Here I shall go through 8 diseases and the area warning signs your body might give you so you can take preventive actions. Heart attack or cardiovascular disease has warning signs including the chest pain, pain in the left jaw, shoulder or arm, and breathlessness when exerting yourself. A CAC test is a useful predictor. Natural remedies like vitamin E, vitamin K2, and significant diet change are recommended. 2. Stroke. Early indicators include weakness or immobility on one side of the body, slurry speech, or dropping face. Quick medical intervention is vital. 3. Infection. Symptoms such as a tickle in the throat, sneezing, or runny nose can signal an upcoming infection. Large doses of vitamin D3, zinc, and vitamin C are beneficial, and staying warm to induce sweating can help your body fight off the infections. 4. Fatty liver disease. Signs include a full feeling under the right rib cage and a protruding belly, a low-carb ketogenic diet, intermittent fasting, and avoiding alcohol as essential. 5. Gallstones. Indicators include the dark urine, flat stool, and constipation due to low bile salts, and increasing bile salts can prevent the formation of the cholesterol stones. 6. Kidney stones. Early signs include deep abdominal or back pain, lemon juice, magnesium glycinate, and avoiding oxalate-rich foods like almonds and spinach are recommended. Diabetes. Warning signs include the extreme hunger, irritability when hungry, frequent urination, and increased thirst, and it's crucial to follow a low-carb diet, practice intermittent fasting, and avoid frequent snacking.